Hey guys, Dr. Justin Marcagiani here. Today we're going to be talking about GLP-1 agonist drugs like Ozempic. Is it good? Is it bad? I'm going to be giving you my take. And again, what you don't know may hurt you. So let's dive into this topic. Before we do, please smash that like button. Love to see your comments below. And again, if any of your family or friends could benefit, please share it their way. So Ozempic is a drug been out the last couple years by the drug company Novartis, made over in Europe. Big drug, everyone's talking about it. Lots of celebrities losing lots of weight because of it. We're going to dive into it, talk about the mechanism and things that you should watch out because they may impact you. All right, so first off, Ozempic, it's a GLP-1 agonist medication. That simply means glucagon-like peptide 1 agonist. So there's a couple different things. It does 4 major things. So the drug mimics that GLP-1 hormone. So it's an agonist. So it bumps it up. It supports it. So it does a couple things. It stimulates insulin secretion as the blood sugar goes up. So as you take in maybe some carbohydrate, it breaks down to glucose in your bloodstream. Blood sugar starts to go up like this. GLP-1 agonist is going to bring up the insulin to bring that blood sugar back down. That's number one. Number two, you typically have alpha cells of the pancreas that produce glucagon. So the beta cells of the pancreas produce insulin on one side, and the alpha cells produce glucagon. Again, things like protein can actually stimulate glucagon. And so what it does is it actually decreases glucagon stimulation via protein. So you don't have the glucagon bringing up your blood sugar at all. So one, it's going to stimulate the insulin to bring the blood sugar down when it goes up. That's one. Number two, it's going to inhibit that glucagon. So when you're consuming protein, it's not going to give it that bump up. It's not going to release that stored liver glycogen either. So for instance, the drug metformin or glucophage actually decreases gluconeogenesis, which is kind of what glucagon stimulates as well. And so it's going to decrease that as well. So very similar. Also, number three, it's going to work on gastric emptying. It slows down gastric emptying. And some of the big side effects that people talk about when it comes to Ozempic is the paralytic stomach. Is it paralyzing or decreasing your intestinal motility? Because it's allowing the food to sit in your stomach a lot longer. That increased amount of time to empty is decreasing the glucose going into the blood. So it's really time releasing that glucose, really slowing it down. It's keeping that food in your stomach longer so you feel a little bit more nauseous. It's slowing down that emptying. You're going to feel fuller longer because the stretch receptors, the baroreceptors in the stomach are now kind of stretched more, so that feeling of nausea, not having much of an appetite is going to stay around longer, and then it slows down, again, that glucose going into the bloodstream. And number three, it's going to decrease the appetite. So you're going to have better appetite regulation. Again, it's going to really shut down that feeling of being hungry. It's going to really promote that feeling of satiation. And so it allows for less food to actually cause more satiation. Now, this is an interesting mechanism because in the end, the problem with that is now your appetite is not gauging you what to eat. So now you may actually be on a very low-calorie diet, not eating enough, and you actually feel full, you actually feel fine, and you're still not eating enough. Because in nature, low-calorie, low nutrition would encounter an appetite stimulation saying, hey, let's go eat more, right? Now that's not there. So now we have some side effects that can happen because of this. So one, we have the impact on our digestive motility. How does that impact SIBO and other digestive IBS issues like constipation, gastroparesis, acid reflux? Lots of side effects being reported on the drug from the drug manufacturer in that area. Two is people have these issues with cravings even when you come off. They're even talking about utilizing this drug for addicts because of the addiction craving, right? So the appetite regulation, it also impacts the part of the brain that impacts addiction. The problem is, can you enjoy food after you come off? I mean, some people say there are some side effects, people saying, yeah, I'm off it, and I still have these lack of desire for food. And that could be a potential problem. Now, because of the lack of appetite, there's a lot of muscle wasting that is being reported on Ozempic drug. And so this is a problem. So you really, if you're on this medication, you really have to be on top of your protein. Are you eating enough? That's going to be a big deal because if you're not getting, 0.75 gram to 1 gram per pound of body weight, you're going to have a lot of atrophy, a lot of catabolic metabolism. That muscle is starting to break down. And then if you come off that medication, now you're going to be skinny fat. Now you're going to be sarcopenic. And that's going to be a problem. So you're going to essentially rob Peter to pay Paul. Now you'll be skinny fat. You won't have the muscle. And so here are my warnings out of the gate. Where this drug makes sense. This drug makes sense for someone that's incredibly overweight. I'm talking 300, 400, 500 pounds overweight, and they have zero appetite control. It may make sense to get the appetite control down, because these people are so overweight, they're so morbidly obese, they could die based on their obesity, and it may make sense. But the problem is you have to get someone making diet changes. You have to make sure someone's coming in getting enough protein. You may need to be adding in additional amino acids. You may need to be adding in branched chain aminos, extra collagen, extra protein to ensure you're getting that 0.75 to 1 gram of protein per pound of body weight, or more lean pound of body weight. If you're significantly overweight, it'd be very hard to do 500 grams of protein a day if you were that overweight. But you can at least ensure that protein is there to maintain that lean body mass. That's going to be a big deal. And you're going to have to be comfortable eating when you're full. When you feel full as can be, you have to be comfortable still eating and getting enough nutrition, enough calories. And again, you have to be aware of the side effects of the gut issues and what that could cause in regards to digestive issues on the backside. Now, my recommendation is people are still not making changes. I mean, these medications are getting fast-tracked for adolescents, for younger kids, for obesity. It does not fix the underlying issue. The underlying issue, we're eating lots of processed food, lots of inflammatory food, lots of nutritionally deficient food, lots of junky bad fatty acids and seed oils. So we got to make the actual food changes. Again, healthy foods, especially healthy proteins, healthy fats from grass-fed, pasture-fed animals, eggs, beef, chicken, good healthy proteins and fats are going to help tell your brain you're full and satiated. But if we're eating lots of processed carbs, you're not going to get that, and you're going to turn to a drug to tell your brain to be full. So my thing is you got to make the healthy diet and lifestyle changes first. You have to get enough protein. If you're going to use the drug, maybe in that 1% of the window where people have really no appetite control. But if you're going to do it, you got to make sure you're doing all the other right things. There are other nutrients that have natural GLP-1 agonist impact, like berberine. I'd much rather see you do berberine and other, intermittent fasting strategies, and run your food through Chronometer to look at your macronutrients. Do some carb cycling, do some resistance training or some interval training. Really get everything dialed in so you're getting root cause, root solution habits and behaviors dialed in that are actually going to be locked in place long term. Because these medications, you're going to just gain the weight back, and then you're going to have less muscle mass because you depleted a lot of your muscles while on the drug. So that's kind of my take on it. Again, that 1%, sub 1%, incredibly morbid obese, no appetite control may make sense. Either way, you have to lock in the diet and lifestyle changes. You have to understand the gut issues that it could cause. You have to understand the impact on your satiation, and are you going to be able to enjoy food the same way once you come off of it? And then if you are going to be on it, you have to be on top of the protein, the amino acids. You'll probably have to supplement. You'll probably have to eat when you're incredibly full, even if you don't feel good. Again, guys, if you want to dive in and you want more support on the functional medicine side, natural means, diet-wise, lifestyle-wise, to lose weight, get your hormones in check. Also, what if you have hypothyroid? What if your female hormones are off? What if you're menopausal, perimenopausal? You're not fixing these issues. What if your mitochondria is damaged? So you're better off really looking more at the root cause, and this may be a very short-term Band-Aid with side effects, or you may gain things back with less muscle on the backside. So think about it deeper. Again, if you want to dive in with my staff and team, there'll be a link down below where you can reach out if you want functional medicine support worldwide on root cause, kind of natural ways to get your metabolism back on track. Again, this is Dr. J signing off. Take care.